Now let's talk about the difference between urinalysis and urine MCS. In one of my previous videos, I think recently, I made a video, a well-detailed video on the parameters that are found in urinalysis. So make sure you visit my page, my profile, the head clue, and watch the full video so you understand this better. Urinalysis is a test that is carried out to check the parameters of your urine. Then we have the leukocytes, the protein, the blood, glucose, nitrite, pH, specific gravity, ascorbic acid, bilirubin, urobilinogen, and ketones. So that's basically what urinalysis does. It's just check those parameters of our urine to check for some health conditions. But urine MCS is the one that goes more in detail to detect the exact kind of infection that you're suffering from. Just as the name implies, urine MCS. MCS means microscopy culture sensitivity. When you give your urine out for urine MCS, they check for microscopy where they get your urine and they view it in the microscope to check for some properties and some things in your urine. Then while culture is the sense where they have to culture your urine to detect the exact infection, the exact either bacteria or fungi or whatever, but to detect the exact infection that you're suffering from. Why sensitivity happens where after the bacterial growth, they pick the growth and they culture it in a media, then they will place some sensitivity discs into it and check the medication. Now, the sensitivity is where the kind of medication that is supposed to knock out that infection comes in, which is why if you have any symptom of infection, it is always advisable you go and run some diagnosis, because if you take any drug, any antibiotics that you feel, okay, my friend took this one and it worked for my friend, if I take it, it's going to work for me, you're doing yourself more harm than good, because each and everybody's body system is different. So if you want to take the proper step in knocking out any kind of infection, that is when urine MCS comes in. Now watch this. If you do a urinalysis test and either leukocyte or nitrite is present, you'll be further advised to run a urine MCS. The reason for this urine MCS is to detect the exact kind of UTI, because the presence of leukocyte or nitrite in urine entails that there is a urinary tract infection. But it will not be known what kind of infection or what kind of drugs will be used to knock this infection out until you run a urine MCS. If there's any other diagnosis you want me to explain, endeavor to drop it in the comment section. And if you need more clarity about this, also drop your questions in the comment section. And don't forget to like, share, and follow for more.